Hooking up for capnography. Waveform capnography is rapidly becoming the standard of care in pre-hospital medicine. I want to take a few minutes to review how to prepare the equipment needed to monitor a patient's end-tidal CO2. The first step is to ensure that you have the filter lines readily available. You should have a minimum of one of each type of line in your LifePak 12 pouch at all times. You can also tape an ET tube filter line to your ET tube so that you will have one in hand while intubating and be less likely to forget to attach it. When using a nasal filter line, it is imperative to properly place the device on the patient, as failure to do so will result in erroneous readings. Monitoring EtCO2 with the nasal filter line while administering O2 via non-rebreather mask will not cause an erroneous reading. Older EtCO2 technology would not allow for this practice, but newer technology does. To use a nasal filter line, remove it from the package and place the device on the patient. Find the orange fitting at the distal end of the tubing and insert it into the port located on the LifePak 12. Secure the fitting into the port by turning it clockwise until it is snug. Do not over-tighten the fitting into the port. You will now be able to monitor the patient's end-tidal CO2 on the LifePak 12 display. When using the ET tube device, it is a good idea to ensure that you have more than one device available to you. If a significant amount of fluid comes up the ET tube into the filter line, it may cause the filter line to fail to monitor expired CO2. To use the ET tube filter line, attach the orange fitting into the port while preparing to intubate the patient. After the ET tube is placed into the patient's airway, attach the filter line to the ET tube and ventilate the patient.